What doctors will never tell you is that after 70, some common medical tests could quietly steal your health, your independence, and even shorten your life. We've all been told that more tests mean more protection. But is that really true after 70? Or have you been pushed into dangerous procedures you don't even need? Seniors, would you know which 6 tests to avoid after 70, the very ones that could bring more harm than help? If you're over 70, you've probably been told to just keep saying yes to every test. But deep inside, maybe you've wondered, do I really need this? Or am I just following orders? I know that sounds unsettling. We grew up in a culture that praises routine checkups as the golden rule of health. Say yes to every screening, every scan, every pill, and you'll live longer, they say. But the truth is, aging doesn't play by the same rules as middle age. After 70, the body speaks a different language. What once seemed protective can now weigh you down with fear, fatigue, or even unexpected complications. Let me share a story. Last year, a 76-year-old gentleman I'll call George went in for what was supposed to be a simple screening. It wasn't because he felt unwell. It was just routine. Within months, George was struggling with side effects, not from a disease, but from the test itself and the cascade of follow-ups that came after. He told me one day, "I thought I was doing the right thing. I thought I was protecting my future. But instead, I lost part of the life I already had." And that's the heart of it, isn't it? At this stage of life, we are not chasing every possible year. We're fighting for the quality of the years we already have. We want clarity, not confusion. Strength, not fear. Peace of mind, not endless worry. That's why today matters. Because in the next few minutes, I'm going to walk you through 6 tests that many seniors over 70 should pause and think twice about. Not because medicine is bad, not because doctors don't care, but because these particular tests at this stage of life may no longer serve you. In fact, they may quietly steal the very things you value most: your independence, your dignity, and your ability to live life on your own terms. So stay with me, because once you know the truth, you'll walk into every doctor's office not as a passive patient, but as an informed partner. And that knowledge might just protect your body, your peace of mind, and your future. 1. Aggressive blood pressure management. Let's begin with something almost every senior knows by heart: blood pressure. For decades, we've been told to keep the numbers as low as possible. Charts on the wall say 120/80 is the gold standard. But here's the twist that most people over 70 are never told. Pushing your blood pressure too low can actually make life more dangerous, not safer. At your age, arteries have stiffened and become less flexible. The heart has to work harder to push blood through them, and sometimes your body actually needs a little more pressure to keep things moving. That extra pressure helps deliver oxygen to the brain, keeps you alert, and gives you the stability you need to walk confidently through your day. When medication forces those numbers down too far, what looks good on a chart can feel terrible in real life. It often leads to dizziness, fainting, sudden blackouts, and for many seniors, devastating falls that can change the course of life overnight. I once spoke with a woman named Eleanor, 78 years old, who kept fainting in her kitchen. She thought it was just age catching up with her. But in truth, her blood pressure meds were dragging her down too far. One bad fall later, she was in a rehab center, trying to walk again after a fractured hip. She told me, "I thought I was being careful. I thought I was protecting myself. I didn't know my pills were the reason I kept falling." And Eleanor is not alone. Think about it. How many seniors have given up gardening walking outside, or even climbing stairs because they feel lightheaded and weak? How many of those moments might be caused not by aging itself, but by over-medicating blood pressure? So that leads to the real question. What good is a perfect blood pressure reading if it leaves you too dizzy to safely walk through your own home, or too tired to enjoy an afternoon with your grandchildren? Sometimes, a slightly higher pressure is your body's natural way of protecting itself. The goal at this stage of life isn't chasing textbook numbers, it's about stability, comfort, and the ability to live safely and fully every single day. 2 routine colonoscopies after 75. Next, let's talk about colonoscopies. Don't get me wrong, colonoscopies have saved countless lives. They are powerful tools that catch dangerous polyps before they ever have the chance to turn into cancer. But here's what few people are told. If you are over 75, the math begins to shift in a very important way. Polyps usually take around 10 years or more to turn into cancer. So if you are 78 or 80 and a small polyp is discovered, chances are it will never become a threat within your natural lifespan. Yet the procedure itself can carry very real risks. The harsh bowel preparation leaves many older adults weak, nauseated, and dehydrated. The sedation, which may be simple for a younger person, can cause heart rhythm disturbances or breathing problems in seniors. And yes, there is always a small but serious chance of perforation, a tear in the colon wall, that can mean emergency surgery and a long recovery. I remember a gentleman named Harold, age 80, who went in for what he thought would be a routine check. He had been healthy, walking daily, spending time with his grandchildren. But complications from sedation kept him in the hospital for days. He told me afterward, "I wish someone had asked me whether it was truly necessary. I was fine before all this." So ask yourself, would you rather spend that week preparing for and recovering from a colonoscopy, or use that same week to enjoy a family trip, a hobby, or simply sitting peacefully in your garden? At a certain point, quality of time matters far more than chasing every possible test. If you have troubling symptoms, unexplained bleeding, weight loss, or sudden changes in bowel habits, by all means, a colonoscopy can be life-saving. But routine colonoscopies after 75, simply because of the calendar, may be a burden your body no longer needs. 3 routine PSA screening. Now let's turn to the PSA test, prostate-specific antigen screening. For younger men, PSA can be an early warning signal, but after 70, the story is very different. Here's the hidden truth. Most prostate cancers in older men grow so slowly that they never cause real harm. Yet a high PSA score often sets off alarm bells, leading to biopsies and endless follow-ups. And biopsies aren't without danger. They can cause bleeding, infections, pain, and most of all, a huge amount of anxiety. But the greater harm comes if cancer is detected. Even if it is the slow-growing kind that would never have threatened your life, the word cancer itself can push men toward radical treatment. Surgeries, radiation, hormone therapy, all of which come with devastating side effects like permanent incontinence or the loss of intimacy. I think of Robert, age 74, who lived a vibrant life before one PSA test changed everything. The test led to a biopsy, then surgery. Later, he discovered his cancer was low risk, unlikely ever to have harmed him. But the surgery left him incontinent. He confided, "I traded peace of mind for a problem I never had." So let me ask, would you prefer to know about a harmless cancer that will never trouble you? Or would you prefer to live the rest of your days free from the fear and burden of a diagnosis you never needed? That is why many respected medical organizations now recommend against routine PSA screening for men over 70 unless symptoms appear. The smarter path at this age is to pay attention to your body changes in urination, pain, discomfort, rather than chasing numbers that may lead you down a road of unnecessary suffering. 4. Aggressive cholesterol-lowering treatment. Let's move on to cholesterol. For decades, we've been taught that lower is always better. Statins became the most prescribed drugs in the world, almost a reflex in medical practice. And yes, for someone who has already had a heart attack or stroke, statins can save lives. But for many seniors over 75 who have never had a major heart event, the benefit of aggressive cholesterol lowering is far less certain than most people think. The side effects, however, are very real: muscle pain, constant fatigue, memory fog, and even a higher risk of developing type 2 diabetes. These aren't small annoyances for an older adult. They can mean giving up beloved activities, losing independence, or feeling years older than you really are. Take Margaret, 79. She loved walking the park trail near her home, feeding the ducks with her great-granddaughter. After starting statins, her legs grew so heavy and sore she could barely make it around the block. She told me, "I thought it was just age catching up with me. I never guessed it was the pill." So let me ask you, what good is a perfect cholesterol number if it steals the joy of walking hand in hand with your grandchild? For many over 75, the more important focus should be on lifestyle, enjoying fresh, wholesome food, keeping the body gently active, maintaining a healthy weight, and never smoking. These are choices that strengthen both the heart and the spirit, without the burden of constant side effects. Sometimes the wisest medicine is not what comes from a bottle, but what comes from living fully each day. 5. Aggressive cancer screening in frail seniors. Now let's move into one of the most delicate subjects of all: cancer screening in frail seniors. On the surface, it feels obvious: catch cancer early and you can fight it. But as the years advance, the equation shifts dramatically. If you are living with serious health conditions, advanced heart disease, dementia, kidney failure, or other chronic illness, the likelihood that a slow-growing cancer will threaten your life is very small. Yet the screening tests still pick them up. And once a cancer is found, the pressure to do something is nearly unbearable. But here's the heartbreaking part: the treatments themselves often take more from a frail senior than the cancer ever would. Surgeries, chemotherapy, radiation, all can leave the body weak, the mind clouded, and the remaining time robbed of comfort and dignity. I remember Clara, age 82, who had a small lump discovered during a mammogram. The doctors urged surgery. Terrified of the word cancer, she agreed. The treatment and recovery exhausted her. Later, she told me, "The cancer might never have hurt me, but the treatment took everything I had left." So I want you to reflect. At this stage of life, what truly matters most to you? Is it fighting every possible hidden battle, or is it preserving peace, comfort, and the joy of ordinary days with loved ones? This isn't about saying no to care. It's about saying yes to care that aligns with your values, your body, and your future. Sometimes the bravest choice isn't another test, but the decision to live your remaining years fully, without unnecessary interventions. 6. Routine bone density scans after 80. Finally, let's talk about bone density scans, or DEXA scans. For women especially, these tests can become routine after menopause. And yes, in earlier years, they are very useful for diagnosing osteoporosis and guiding treatment. But after 80, if you've already been diagnosed or are on treatment, repeating these scans often adds very little. Why? Because by this stage of life, almost every woman and many men already have some degree of bone thinning. A repeat scan rarely changes the treatment plan, but it can bring unnecessary anxiety, discouragement, and financial cost. I remember Helen, age 83, who went for yet another scan. The results showed no improvement, and she felt as if her efforts were wasted. But the truth was, her medication was keeping her stable. What really mattered were her daily habits, the balance exercises she practiced, the rugs she removed from her hallway, the supportive shoes she wore every morning. So let me ask, what will keep you safer, another scan on paper, or the confidence of knowing you can move steadily across your living room without fear of falling? Because the reality is simple. Fractures after 80 are caused less by numbers on a chart and more by falls. A slippery bathroom floor, a loose carpet, a dim hallway, those are the real threats. Prevention means strengthening your balance, adjusting your environment, and nourishing your body with calcium and vitamin D. That is where your energy and attention can bring the greatest reward. So what does all this mean? It means after 70, healthcare isn't about chasing every test. It's about protecting your independence, your dignity, your peace of mind. More isn't always better. In fact, sometimes more can be harmful. This stage of life calls for wisdom, not reflex. It calls for conversations, not assumptions. Your doctor's job is to guide you, but your job is to ask, will this test truly help me live better, or will it simply weigh me down? The choice is yours. Don't let fear or routine decide for you. Let wisdom, dignity, and the life you still want to live guide your decisions. I'll leave you with this. Have you ever gone through a medical test that left you worse, not better? Share your story in the comments. You never know who you might help. And if you found today's video eye-opening, subscribe and stay with us. Every week, we bring you honest, empowering guidance to help you live stronger, wiser, and healthier after 60. Because your best years aren't behind you. They're right here, waiting to be lived fully.